The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Dr. Katie Kennedy with us. She is a mom of two and a board-certified pediatric specialist in physical therapy. She is the co-founder of Strive Pediatrics, and she's passionate about empowering parents with the knowledge and tools to help support their child's journey. Thank you so much for being here with us today.
Of course. Thank you so much for having me.
We're excited to have you on and learn a little bit more about what you do. This is the third episode in our kind of bodywork series that we're doing here, just kind of learning all about all of the different cranio options. And so we're excited to learn a little bit more about what this is, because this was a new concept to both of us. So for those who may not be familiar, including us, can you explain what craniosacral fascial therapy is and how it differs from other therapies like regular craniosacral therapy?
Hold on. Yeah. People watching on YouTube are going to be like, what is her face? Because I was like, all this craziness. Because I was like, wait, which one is this? Because there are so many, you guys. It's like cranial everything. I love that you just called it our cranio kind of thing. Because I don't even think I have craniofascial or facial or fascial. How do you say that?
Yes, fascial. So it's craniosacral fascial therapy. And a lot of times I like to use the acronym CFT because, again, it's a mouthful. Even when it comes to craniosacral therapy, there are different types, different kinds people are trained in and certified in, and that kind of gives nuances to their approach. When it comes to craniosacral fascial therapy, there is only one approach currently. So it's called the Gillespie approach as well. Dr. Barry Gillespie created this approach, and it is a gentle whole body modality or form of body work that kind of combines craniosacral therapy and also myofascial release, which is working on the fascial system. And so I'll kind of take a step back to help you kind of understand how this bodywork treatment modality works. And so when we're thinking about the craniosacral system, what that's really comprised of is the brain, the spinal cord, cerebral spinal fluid, and cranial nerves. And that craniosacral system is kind of embodied into our fascial web. And so CFT looks at those two systems as combined because the fascia is within it. When we're thinking about fascia, I love to use an analogy with an orange. I think as parents, we probably all peeled a million little cuties or clementines. And what happens? You peel that orange and there's just white interweb stuff that covers everything, right? Then you have to separate the little membranes and there's white stuff all over it. And then you think you got it all. You hand it to your toddler. Your toddler screams and is like, what is this white string on my orange? And so I like to explain that as fascia and kind of give that analogy. And that covers our body from head to toe. So CFT treats both of those systems. And we're really going and finding where that fascial restriction is to release it and to also then help that craniosacral system function better.
This is really interesting because now that this is our third episode and we're learning things about each of them, I'm trying to make them work in my mind. So what I'm kind of feeling is the first episode we did was just craniosacral. So she talked about fascia, but that wasn't the main thing, right? So I feel like it's craniosacral, and then you have craniosacral fascial, which adds in the fascia piece of it and pays even more attention to that. And then we had another episode where it was talking about cranio-chiro, like within the chiropractic. And I feel like that's all of them combined as well, but then incorporating also chiropractic care. So it's so interesting to see how these all are so similar, but you guys use like different modalities or your own specializations to integrate with these systems. How does somebody, by the way, I love that you said the thing about the orange because
It's so true.
we think of an orange differently. We think of it in terms of when people ask about a membrane sweep with pregnancy. I'm like, okay,
Yeah.
it's kind of like going between the orange peel and the white part, the pith, and you move around and you're separating those. That's kind of like a membrane sweep. So I love we're all using
Right?
fruit. Yeah, we're all
Yeah.
using the fruit to help people understand. So, how would someone know if they need this, which is what we ask everyone, no matter what kind of thing they're teaching us about? How do we know if we
Yes.
need this?
Yeah. So CFT can be beneficial for all ages. So I'll kind of first speak to infants specifically. And then I can kind of touch a little bit kind of on toddlers, adults. And then one of my favorite things to do is to do mom and baby dyad for CFT. And it can just be just really an impactful, powerful way to kind of start that fourth trimester and kind of transition into that. So specifically for infants, a lot of times we work with babies that have excessive crying, fussiness, have feeding challenges. Maybe there was like colicky babies where, you can't put them down. And within even striving within CFT, we really try to get to the root cause of like, where is this dysfunction? And so CFT works a lot, like I said, on that fascial restriction to help the body move better. But since we're also working on that craniosacral system, we're also working on that central nervous system, which if that's functioning well, that baby can participate in activities like feeding, like sleeping, like digestion and pooping and playing. And so that's why I love this modality so much, because I really feel like they're so intertwined that you really can't separate the two. I love that you even spoke earlier about, people's different approach and scope of practice, because even me as an infant physical therapist and our whole infant occupational physical therapy team are trained in CFT. I'm bringing that kind of lens as well when I'm doing CFT, right? And so I'm able to kind of take a step back and assess other things to see like, okay, is there something more going on than just the craniosacral fascial system? But like my treatment approach might be a little bit different, again, just based upon my experience. And then when it comes to kids and toddlers, sometimes those children might be struggling with nervous system regulation. So maybe they have sleep challenges, maybe they have bedwetting or digestive issues. Maybe there's some behavioral ADHD, sometimes headaches. And then we also incorporate CFT with some of our more medically complex kiddos that might have neuromuscular disorders or genetic disorders. Because again, if that fascia is not moving properly, it impacts so much because it covers so much. And then typically with adults, a lot of times adults will come in with headaches, maybe concussion or head injuries, maybe anxiety. We work also with adults who are getting maybe oral releases and they want intraoral work to kind of get that full body approach to work on that fascial restriction before we do any cutting or do a procedure. And so for adults, those are some different things that we do address. And then within that mom and baby dyad, we do work also with moms who are pregnant, who again want to kind of set up their body to be in a state to bring a baby into the world. And then with the fourth trimester mom and baby, that's usually within that hour session where we're working simultaneously on both mom and baby. I love to do direct skin to skin during that time if possible, just even get those benefits. But it's kind of like bouncing around of where that fascial restriction is and working on both of them to help that central nervous system regulation, to help with any tightness or fascial restriction, maybe from the baby from in utero positioning or the birth process. And then also to help mom kind of transition, just even coming out of birth, of just, helping her body with any restriction, but also that central nervous system piece is so important even for them to then like participate in those activities such as feeding, breastfeeding, bottle feeding, sleep.
That makes a lot of sense. So, um, when we're talking about like um, what are the benefits of all of these things? How early can a baby kind of start all of these things?
Yes. Yeah. So a baby can start as early as birth. I've actually had the opportunity to work with a handful of babies within the first couple hours. And that's just been such a special opportunity to be a part of. And even just feeling that baby unwinding in your hands, and even just the differences of how a baby releases almost so like naturally. Like think about when you hold a baby, sometimes they go into that like arching rotation position. A lot of times it's almost like they're trying to unwind their fascia. Think about us. We wake up first thing in the morning and what do? Like, right, you like extend, you open, you rotate, you start moving your body. So we can start CFT actually right at birth. I've even heard of a story of a dad who actually got trained in CFT because he wanted to be able to do CFT with their baby after their baby was born. So really it can be as early as birth. It is a very gentle baby or patient-led form of modality. And so, it can be done as early as birth. I mean, it can even be done with medically complex babies. It can be done with NICU babies. It's really this gentle, full body, hands-on approach.
This isn't one of our questions on there, but I'm just like, when you're describing this, like, what does it kind of look like when you're working with a baby like that?
Yeah, that's a great question. Even so, everyone knows as well, when we get CFT done, even for children and adults, typically, like clothes are fully on. With older kids or adults, you're on a mat table. With babies, it's usually in your lap, or moms maybe holding them or breastfeeding it. We can work around. And then for toddlers, they're just running around playing. Not running. We try to keep them stationary and playing, but they're just playing and we're working around them. So typically, what it looks like is we ideally will have one hand on that back of the head, the occiput and the sacrum, and that's us kind of checking into that craniosacral system. Then we usually also have what's called like our fascial hand, which is checking into that fascial restriction. And I'm assessing where there's tension, and I'm going to go toward where the tension is. And then I'm using my hands as a form of manual therapy to relieve that tension. And then I always check back into the body, right? I'm going to actually go back to the same spot that was restricted to see what it feels like. But then I'm going to look elsewhere. Think about, again, our fascia is all interconnected. If there was a tablecloth on a table and you twirled one corner, what's going to happen to the whole tablecloth? It's all going to pull, twist, turn, get shifted. So we're constantly moving our hands to kind of check in with that fascia, because you might unwind one part of the body and then you check in elsewhere and you're like, oh, okay, this is a little bit more restricted here. Let's get started. And so that's typically what it looks like. For those toddler age kids, sometimes the parents are like, it just looks like your hands on them and they're playing. And that's what it looks like a lot, right? We're really purposeful of guiding our hands. And like I said, it's patient led. So, if I put my hand somewhere and it feels tight, but that child is like, nope, or that baby is looking away and it seems like I don't want you there, we're going to move elsewhere. And we still can get benefits of fascial unwinding with working elsewhere because everything is connected.
Do you ever unwind that area and then you go back and you're like, man, the first area is messed up again?
Yes. Yeah. Well, that's why you always check back into. And it's so true as well that, the body is like such a puzzle piece, again, is so interconnected that you think you're like, oh, based on what the baby looks like, it's going to be most restricted here. And then sometimes there are some patterns, of course, but then you put your hands on them and you're like, oh, I was wrong and humbled. Okay, let's start here. And it's also really great to kind of see within a session, you can see changes in posture, and alignment. Sometimes these babies come in, they have no neck, right? Their hands are fisted, their toes are curled. Even if I told you to go take a sip of water and I scrunched your body in that way, you're not going to be able to, right? So how can we expect that baby to participate in feeding? So even within a session, we can kind of see those improvements of postural alignment. Another important thing, though, is again, just with my physical therapy background, is we also look at function, because again, if there's dysfunction, sometimes CFT might not be enough again to fully resolve everything, because we can, unwind the fascia, but if that baby goes back to dysfunctional movement patterns, sometimes we see that fascial restriction return. And so the goal is CFT is to unwind the body, release fascial restriction. And it's not something that I'm like, we're just going to do this forever, your whole entire life. We want to see that fascial restriction improve and maintain. Of course, aging, we can accumulate fascial strain, just overall growth, any type of like physical trauma, emotional trauma, we can accumulate. But the goal is to restore that fascial mobility and have you go forward in life thriving.
That makes so much sense about when you undo it, you may see it come back because of the way that they're doing something at home. It's like they already got used to doing that. And that is really helpful to think about because you're like, well, then why does this keep happening? Well, because we have these other things that need to be fixed. So I love that it's in conjunction with this physical therapy that's helping them learn how to do something right. My daughter she just had her second foot surgery because she had extremely flat feet and it was like a very intricate surgery. And at PT, after the first side, it was so interesting to see them have one side done and one side not. And now we're rehabbing the one side that was done and how her other side was still so poorly functioning because it's just used to doing things that way. And we had to like unlearn the way she used to do everything. Yes, compensating for it.
And it's good that we can compensate, right? Like, again, it's good that we have two options to breathe, through our nose and through our mouth. If we had one option, that wouldn't be great. But what's really ideal to help you thrive as an adult, as a child, as a baby? Nasal breathing, right? We want that mouth closed, lip seals, tongue suction, and breathing through our nose. At the same time, if that's not feasible, it's good we have another option, but it doesn't optimize for a lot of other things. And so that's why even, within, we work with families of all ages. And so within CFT, if we're only doing CFT, we're only doing CFT. At the same time, you kind of get a 2-for-1 because I can never turn off my physical therapy eyes and brain and hands. And so we always are kind of screening to be like, okay, is this fascial restriction really like it, right? In utero, babies run in a room. They get comfy, cozy. They get longer, they run in a room. Sometimes I notice more with the birth process, really quick deliveries have more fascial restriction, or sometimes more of those like longer, more traumatic deliveries where maybe the baby was stuck or maybe something else happened where I see more fascial restriction. And so really, again, we want to improve also the function if there is dysfunction so that they don't go back to those movement patterns and that tightness and restriction.
It's really cool. And you mentioned a little bit earlier, but I'd love for you to explain a little bit. You said that you want the nervous system to be functioning properly. So how does a CFT support that overall nervous system health in kids?
Yes. Yeah. And so within that, like I said, that fascia kind of covers all those aspects of that central nervous system. And so if there's restriction or tightness, it can kind of help the flow and function of that. So within kind of releasing that craniosacral fascial system, we can enhance brain function. We can reduce stress. We can improve the body's ability to relax, even impacting kind of those like main behaviors and needs as far as sleep, eating. That overall also can impact that central nervous system and kind of get them more functioning in that rest and digest state, not that kind of fight or flight state. And so that's why, again, CFT can kind of spill over into so many other buckets. Sometimes, families come in with a main concern. Maybe it's just a breastfeeding challenge. But then sometimes I see these improvements of like, oh, wow, my baby now is like pooping more regularly. My baby's actually sleeping longer stretches. My baby is actually tolerating tummy time more. And so it just really spills over into so many more buckets just because that fascia kind of encompasses everything. And we are able to target that central nervous system within this modality and form of body work.
All is just so interesting the way that all of these things can connect with our whole body. And I think like things that we wouldn't necessarily think about, like a funky position in birth, those sorts of things, like a difficult or, even a traumatic delivery, and how that can affect like the whole body and things that you wouldn't necessarily think about. But I think I've said it on probably all of the episodes that we've had so far, but it is just so cool to see how these things can help in so many different ways that we wouldn't necessarily even consider. And I love it. It's just also fascinating.
Yeah. And I really feel like these forms of manual therapy really like optimize a lot of things, right?
Yeah.
Like even sometimes families, again, just upfront are like, we want CFT no matter what, in a sense of just like, can we optimize our baby's health and function and movement? Again, we kind of can pinpoint some impairments that are going on, but again, it's just a way to optimize and not only help our children just survive, it's kind of like setting them up to thrive and promote the rest of their development if that system's functioning more properly.
Yeah. I mean, it's like going to, counseling or therapy just for keeping yourself healthy, or going to couples therapy to just check in on your relationship. It's the same kind of idea for your body and for your children's body. It's just making sure you're healthy, like you said, optimizing the health. I love it. It's so cool to learn about all of those things. So if there's one thing, and I know it might be hard to choose, but if there was one thing that you would really love parents to take away from CFT and its benefits, what would that be?
Yeah, I think the one thing that I would want them to take away is knowing it's a full body treatment and form of manual therapy, that we can work within the mouth, we can work at the neck, we can work at the trunk. And it's really gentle and patient led. So, it's not really like heavy hands, it's not aggressive. And at the same time, CFT can also be beneficial for all ages. I think it's helpful just for families to know that. I know that your audience, right, is kind of more geared towards babies. At the same time, sometimes moms and families don't even know that these options can benefit other things. Another thing that can be helpful too to know is, people's background training also gives you a better understanding of their approach to these treatment modalities. So I always empower parents to ask questions and to find out, with a specific provider, what's your background, what's your treatment approach, if you feel comfortable asking those questions, because it can give you a good idea too of what lens that practitioner is going to approach this treatment with.
I love it.
I love that because and you're saying like the mom might not even realize or the parent might not even realize that they need it. Like, what about breastfeeding? And we're like sitting there with our head down, looking at our baby, and we're bringing the breast to the baby instead of the baby to the breast and doing all of these things that make it harder on our body. Carrying a stupid diaper bag. I was like, backpack all the way. I'm not doing one of these one-sided things.
Don't do the one shoulder thing that I do. I have my backpack and I put it on one shoulder and I'm like, what are you doing? This is why you have a backpack.
You're like,
you
I'm
just carry the baby on the other side.
I know. I should know these things.
Carry the baby on the other side. That's funny.
Yeah. Oh, that's true. Thank you. But that's a great point to bring up though. And so sometimes we might be working with a baby and we're kind of watching mom, as you said, that comment of breastfeeding where she's kind of forward. Also, I know firsthand, if your baby's having feeding challenges, is not sleeping, and you can't put them down, that is extremely stressful as a mom because you're like, how do I help my baby? And so a lot of times we'll have moms, we start with their baby and then we have a conversation of like, oh, we do CFT for adults. We can do CFT for moms. We can actually do like a co-session. Is it okay if I work for like 15 minutes on you? Just to help her, right? I mean, it is so important early on to help with that bonding and attachment. And CFT can be so impactful of helping with that, not when it just comes to baby, but also mom as well. So, we actually have someone right now that same exact situation just was happening. We've been working with baby. We've been having this conversation with mom of like, can we do some CFT? Because mom can benefit from it as well. I love also with our team, if we have to do training, I'm like, okay, like let's do CFT on each other because we all need some in our life. So
yeah.
Can I come work with you?
Yeah, we want to come for a day. We want to come hang out in your office.
Let's do it because it will help you understand what it feels like and the benefits of it. So
don't threaten me with a good time. You're saying the whole like that mom was coming in and you want to work on her, but like, is she going to let you? We'll see. But that is the thing that sometimes people don't realize is sometimes we're feeling this emotional disconnect because we're so frustrated with whatever we're dealing with, because all parenting can be frustrating, but like early parenting, especially when the child can't communicate with you and all of these things. And so you're sitting there struggling, like, what do they need? Am I good enough? All of these things. And really restrictions in your own body could be adding to that anxiety and probably are. And it can also sometimes just make you feel resentful because you're on the back burner. Mm-hmm. So when you said, can I just work on you for 15 minutes? I'm like, oh my God, I can't even imagine a time where I would say no. I'd be like, yes, please. I know. Like somebody work on me.
Watch them take a deep breath, right? Like sometimes when we're doing this, we're always watching kind of like breathing posture. Even with babies, you'll sometimes see that. But with adults and with moms, as you're working with them, you might feel a big release. And then you almost like see them just take this deep breath and like relax into that. Being a new mom, it's very challenging, right? And like your whole attention goes to the baby. So even within sessions, if you kind of like pivot that a little bit towards mom, just to help her and support her as well. We love incorporating that into our plans too, if we're able to.
I don't
And they're
think we've
so
done.
interconnected too.
Yeah.
Like, mom holding stress, a stressed out mom is going to be a stressed out baby. A stressed out baby is going to be a stressed out mom. Like, they shared the same body for so long. I think that there's so much of that connection that's still there. And we see that. And then a stressed out mom means a stressed out dad, probably.
Yeah.
Yes. Yeah.
Our postpartum doula, Jess, has said, like, every once in a while she has a family where a baby is really just like crying when she gets there and mom wants to cry. And then the moment the doula takes the baby stops crying. And then the mom feels like she's not good enough because why couldn't I get my baby to stop crying? And she's always like, look, I just got to sleep during the day preparing for this shift. I'm not attached to this baby in the same way you are. I care about it, but I'm not like you. I'm not breastfeeding this baby. Like, I have so much less stress and the baby feels that. So don't like hate on yourself that your baby is not reacting well to you because you're stressed out. That's why I'm here. So let me help, but that is really difficult. I don't think we've done any of these episodes, Sam, where you and I haven't at the end been like, well, I want it.
I know.
Like, or man, my kid needs that. So this has been really cool because every one of these episodes, we learn something new, which is our favorite part. So if someone was interested in learning about CFT, doing it with you potentially with Strive Pediatrics, can you tell us how they could find you? And we'll also add it in the show notes.
Yeah, of course. So like I said, we do offer CFT for all family members. And it's not that it's funny, but sometimes we start with like one child and then they're like, actually, can we do two of our kids? And then the parents are like, can I get in on this too? So we do family CFT sessions as well. But we do treat most of Williamson and Travis County for in-home visits. And then we do currently have our office location in Round Rock. And so you can either reach us at our website, that's strivepediatrics.com. Within that website, we really try to make it as user-friendly and easy for families to get a hold of us. So you either can directly submit what's called a form submission. Under the contact, you can directly schedule a complimentary phone call just to discuss your concerns. We love those phone calls because those phone calls also sometimes help us differentiate, okay, should we schedule you for just CFT or should we do more, infant or pediatric physical and occupational therapy and we'll incorporate CFT within that plan. So we do those complimentary phone calls and then you can either call us at 737-443-9844. And then our social media too just has some general information just about CFT, and our website as well gives a lot of information as well. If parents kind of have questions and don't know if they're ready to get started, we try to just put as much information there as possible.
Amazing. Thank you so much for all of this. This was amazing. And I can't wait for our listeners to start learning more about all of these things. It's awesome.
Yeah, because if we had known about them when our kids were little, we would have done that.
I know. That's why I'm always like, I've been a practitioner for 10 plus years and I've always geared towards more manual therapy and I'm trained in a lot of different forms. And I really feel like CFT is a missing piece and link that is very important. I'm trained in other things and it's a very effective treatment modality and form of manual therapy. That's why our team is all trained in it. That's why it's kind of like, that's a standard. Yeah.
I didn't ask you about this, but is this covered by insurance ever?
That's a great question. And so if it's just CFT within a wellness plan, it is not covered by insurance. But within our practice, if it falls under physical or occupational therapy, you can submit for insurance reimbursement because it's a form of manual therapy. And so that's also a really added benefit of, working within a practitioner that has a degree in this or has a certain certification where we're able to do it as manual therapy. So our whole team, like I said, can submit those super bills for reimbursement. And then if someone's just looking for a CFT provider in a different area, there's also a directory on the main website where you can also find a practitioner. And the directory also gives little bios, and that can again help you know what's their background and kind of what's their approach as well, too.
Awesome.
Amazing.
Cool. Thanks for that. Thanks for taking that last minute rando question in there. It was so great having you on. Thanks so much, Katie.
Yeah. Thanks for your time.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.